All right, so if everything is good to go, you should see my screen. So hello and welcome everyone. My name is Pierre and I am the training coordinator for the ChalkBright Network. Welcome to our ongoing learning series webinar session today, where our speakers will explore the use of social media tools to enhance engagement within patient-oriented research projects. To the session today, I would like to welcome Amanda, Ricky, Brooke, and Bryn, who each bring a variety of perspectives and unique experiences to this topical discussion. I also want to welcome Kent, who is going to help us moderate some of our questions and discussions today as we delve a bit deeper into this topic. Now, before I hand over the virtual podium to our presenters, I just want to remind you to please disable your webcams and mute your microphones when not in use to ensure a smoother session and to limit any background noise during the presentation. And near the end of the session, there will be an opportunity to interact with the facilitators. So we certainly invite your input over the mic or through the chat feature at that time. So what exactly will we be exploring today? After I set the stage and provide a brief overview of the more popular social media platforms used in Canada, Bryn will discuss how to leverage these tools when communicating science more broadly. Ricky will explore some key accessibility considerations that need to be taken into account when you do use these mediums, or media, I guess. And then lastly, Brooke and Amanda will delve into the importance of tailoring content specific to your audience and also showcase a few great examples that we can all hopefully learn from. We'll then open up the floor for some general questions and answers that Kent will help facilitate. And then if time permits, we'll share some overall considerations that you should or that you can employ when you do develop your own social media strategies to engage with your patient population or patient partners within the research that you do. Now, if we do run a bit over time, we'll certainly package some of those notes in and share some of the resources with you in a follow-up email later this week. So to get us started today, we want to get a sense of sort of what your experience is with using social media tools within the context of a research project. I'll pop in a link in the chat box where we'll just go through two questions, and it should be in your. There you go. It should be in your chat box right now. So if you want to just navigate there real quick, there's going to be two questions we're going to ask, and they should be active. The first question is querying you on whether you have implemented a social media strategy to support your research efforts in some capacity. So we'll give that a few seconds, have you input some of your thoughts there. All right, so it looks like many of you have. I'm still interested to see the next question. Not advancing. There we go. No. There we go. So for those of you who have employed it or have considered employing it, where in the typical life cycle of a research project have you seen it implemented, or have you implemented it to, I guess, varying degrees of success? So you should be able to pop in a few answers to that question, and it'll be interesting to see what you all find. All right, so execution phase. We see recruitment, we have end of project, knowledge translation, mobilization. So we'll give that another quick 10, 15 seconds. Feel free to add more, as it's not limited to one response per entry. All right. So it seems just generally the majority of phases within the project lifecycle that you have typically seen or have used social media. has been at the stage of recruiting participants or patient partners, but as well as broadly disseminating your findings, I guess, either to your community or the population as a whole. I don't think that is surprising. Kent, did you want to comment on any of these?
Yeah, it sounds like, as you were saying, these uses of social media fall into two main categories, essentially at the beginning of projects and at the end of projects. So I'll be interested to hear more about what our presenters, have to say in the event that maybe we have missed something there, and there might be actually other ways that social media can be used as well.
And that's a great point, Ken. Yes, I think that's what my hope is from the session, at least to get us all thinking of where else in each project can we actually start leveraging these tools. All right, perfect. Thank you so much for your input, everyone. So perhaps it would come as no surprise to you that Canadians are quite active social media users. As of February this year, we have over 33 million active users who typically interface with about 6 platforms a month. And we see an average daily use of about 2 hours a day, where we are all scrolling through our feeds. Probably not the most productive use of our time, but hey, I guess that's what we're doing. And I guess it's probably not surprising that perhaps over the last 2 or so years, we have seen an uptake of active social media users just because of the pandemic and folks being not able to connect in more social settings. So it certainly has been a tool that has we've seen increased engagement year over year, perhaps precipitated a bit more by COVID. So as such, I gather, perhaps goes without saying, that social media platforms do present a powerful tool that you can use to engage with your particular patient population and more generally reach the broader community at large. So of those 33 million active users, there is 5 or so platforms that are quite popular in Canada, and these, of course, include Facebook, YouTube, Instagram, TikTok, and Twitter. And I'm sure we all have had various interactions with each of these over our uses of these platforms in personal or professional capacities. Now, whether it be long-form videos, pictures, or a idea condensed to 280 characters, each platform strives to engage users and both communities through a variety of interactive mechanisms. Now, although open to really everyone, the evolving nature of these platforms has established a particular niche demographics that are important to take into consideration when you are trying to target a specific population. For example, Facebook users are by and large approaching middle age, while TikTok and Instagram users generally trend to be of a more younger demographics. That's how you get your younger tweens and teens is through some of those interactive platforms. And as we just explored during that poll we just shared, it seems like the vast majority of social media platforms are used in that recruitment phase when you are looking for study participants or perhaps looking for partners to develop projects with you. And increasingly, it has become more popular to engage these platforms when it comes to sharing and disseminating your information. But one of the things I guess we're hoping to have you all take away today is thinking about the myriad of other ways that these platforms can be leveraged to further engage or further enhance the engagement of your particular target population. So are there ways that, at the beginning of the project, can we crowdsource input to help further define and refine your research objectives? When it comes to data interpretation, can we use these tools to better contextualize what the findings mean to the particular cohort we are working with. Are more generally, if you think of the time span of a project, when you are in that data collection and analysis phase, that typically takes the bulk of the time of the project, when there really isn't much opportunity for broader engagement activities. Is there a way that these tools can be leveraged to better keep your participants or your patient partners informed on the status of the project and sort of where things are going? And sort of how, as we were touching on through the poll, when it comes to that end stage of the project, when it comes to publicizing or mobilizing your knowledge, is there a way that we can more effectively leverage key contacts, or I guess quote unquote influencers, to help more broadly share these findings, so that key decision makers can start to more closely interact with these data, and perhaps see how the findings can apply to the particular file that is on their desk. So with that really brief and quick overview of social media tools, and perhaps some elements, some avenues for incorporating it a bit more broadly in the project, I wanted to hand things over to Bryn, who will continue on and touch on how we can more broadly communicate science using these tools.
All right, thanks so much, Pierre. And I'm just going to share my screen here. Perfect. Yes, so thanks very much, Pierre, and to the Childbright team for the opportunity to participate on this panel. So to take things forward from Pierre's introduction there, I'm going to share one approach to creating an online presence, communicating science with others. It's important to think about what inspires you to consider creating a presence in social media to share your science. And perhaps strangely, a lot of this work is actually done offline before the preparation before you can carry on online. So to get started, it's really important to consider the reasons why this is a good idea for you and your project. Taking time to reflect on your goals, both personally and as part of this project. Is it to raise awareness? Is it to educate or advocate? Is it to stay informed? Maybe you want to start finding out knowledge about a healthcare issue or condition. And as you build a network online, you will want to participate in conversations and start creating and sharing your own content. So whatever the reasons are, taking the time up front to think about the shape of a plan will help you feel a lot less overwhelmed by how to approach each of the platforms that Pierre was showing on his slides, even if you're already on those particular platforms. I should say, of course, on my first slide, you saw that my handle @BrynPhD. I'm on Twitter and Instagram, and I reference a paper there, but I'll reference some materials and share them in a thread as well. So feel free to find me on there and get access to some of those materials as well. I do highly recommend the Bloom paper from which I took this reference as a good starting point for conversation. But once you've reflected and kind of thought, okay, what is it I want to do? You have to further clarify your specific goals. And with them, the people who should receive the messages that you have and how you want to get those messages across. There's a lot of great resources and templates for not only building a knowledge translation plan, but also for building the materials and the content you want to share, be it infographics or other visual media. So certainly reaching out to any of us to ask those questions and getting access to those resources. We're happy to share suggestions. But there's a lot of great resources and templates, and you can use those to guide you and your team, or simplify it really with these 5 questions that I have on the slide. And these really do sort of form the backbone of a knowledge translation plan. So you first, be more specific about those goals that you reflected on in the previous slide. Maybe earlier you said you want to educate as you share your research, but is it with the goal of influencing healthcare policy? Is it that you want to influence how clinical practices and care is provided in your area? Is it to raise awareness that the research that you're working on has found X and Y? Once you specify each of those goals for your project, you can more easily identify who should receive those messages. Different goals are going to have different audiences. And if you want to influence a clinical practice, for example, you may want to target those who deliver the practice. You may want to target those who provide the resources for it and fund it, and also those who receive it, the individuals living with the particular experiences under study. If you want to raise awareness, maybe your target audience is slightly different, and it's like a nonprofit or a community group, and maybe a wider sampler of providers and people with lived experience. So each of those goals is going to have different people receiving that message. They're the same across goals, but they can differ. But it's important to figure that out, because it really does lead to the third question in here on the slide. How do you want to connect with your audience? So how someone in government wants to receive information is going to be different than a community member. And this is where you're going to find that home for your social media presence and activities. And then the last two questions: do you have the resources that you need to accomplish? And do you need help doing it? And that's really getting at more the financial material costs and the human resources. Do you have the talent, on staff? Do you have the time or capacity to take on, writing the messages, translating messages, designing graphics for it, et cetera, et cetera. Maybe you do have that skill set, maybe you don't, you need to outsource that. So those are the 5 questions that you need to really think about and address. And this is, again, like I said, it's offline. You can do that with a piece of paper and a pen and your team around the table. But tying back to that third question, that's really what we're talking about today. And jumping back to the how, and again, Pierre had a great overview there of the different demographics and users for each of the more popular media that we see frequently used in Canada. So if you decided that some of the people in your audience can be best reached via social media, which platform do you use? I mean, as he shared, that often we're on about 5 or 6 platforms ourselves, but which one is the best for the type of thing you're trying to communicate? So definitely, reaching out for more information, or also doing your own searching on demographic profiles. They seem to update those regularly to help tailor your message and make sure you're not spending too much time on something that won't get the message, get sort of the emphasis that you need. And I know Amanda and Brooke are going to have some great examples of one project doing just that, doing a great job at that. But generally speaking, what I found, and this is my own sort of rough analysis, is that videos and images tend to do better than text alone. Combining visuals with written words is quite powerful though. So oftentimes, trying to share messages, I will try to combine both images and text to address sort of all the different kinds of users that learn in different ways. Younger audiences also tend to skew more to the visual media that are coming up. I put Snapchat on there, but TikTok is a big one, Instagram. Whereas folks like me who couldn't make a phone call and use Netscape at the exact same time, gravitate more to the written word, and bite-sized media is increasingly preferred over these longer epics and blog posts because of attention span changes, because of trying to cram all of these different platforms and contents into the 2 hours we spend a day on the internet. So I find where I mentioned the community piece, though, on the sort of the Twitter and Facebook side, I find these formats have more of that networking and community building feel. And that's what I'm getting there, where you can make more linkages and have conversations more than perhaps some of the more visual platforms that are streaming to the micro video format. But above all, I would say starting small, pick one to focus on, and then incorporate platforms as you go and as needed. It's otherwise overwhelming to manage all of these accounts without first knowing what works for you and the time and resources that you actually will have as your project is continuing on. And then once you've done all this this groundwork, I would say just do it. We can be sometimes a bit frozen by apprehension that, oh, will I say the right thing online? How will I do it? Sometimes once you've done all this pre-planning, you are ready, jump in and just do it. Let others know that you're online after you sign up for an account. If you don't have one already or you need a new one, find out other people, other research labs, other groups, go looking through other people's profiles for their followers, see who is interest, and let people know in your presentations, like I did at the start of mine, that you're online and that you're open to having these conversations. Curate what you see when you go into the app. So that means, muting certain words or perhaps even profiles to make sure that it is a safe environment for you to conduct your networking and communication. And don't be afraid to use drafts to sketch out ideas or even pre-plan tweets, or I often use Twitter, so I reference tweets and to prepare for things like conferences and meetings, so you're not spending the entire time on your phone. But you can have content available as you go. And then I think above all, and we can get into more details if you have more specific questions, I think above all, remembering that social media is an interactive media. So remembering the social part of it. Don't be afraid to ask questions and interact with others. I find, especially companies, they'll often push out all this content, but not necessarily engage back when people are asking questions or making comments. So don't be shy. Asking questions, it's two-way conversation, sharing other people's material, quote tweeting it, adding your own analysis to it, invite others to events and comment on their work. That's how I became on this panel. And I think it's fabulous. And, tagging other people and using appropriate hashtags. And each of these is more sort of detailed discussions, but regardless of the medium, as well, remembering that overall visual does tend to work better than text. And, I guess the final thing I would say before I pass it on is that definitely don't worry that you may not sound like some influencer with thousands of followers. First of all, things take time in building an online presence, and, sharing your science with your own unique voice and perspective and authenticity is always a great strategy, bar none. And I think, regardless of your role in a team and within a particular community, you can find great connections online, and you never know how it might evolve from there. So that's all I have to say for now as a general overview. I'm going to pass it on to Reki, who's going to share more on accessibility.
Hello, everyone. So I'm just going to share my screen so you can see. All right, so you should be able to see my screen. So today I'm going to share about accessibility considerations. So thank you so much to Pierre and to Childbright for having me. So my name is Raki Chowdhury. I'm the communications manager at CASDA. CASDA is a national organization that works with the community to advocate for better outcomes for autistic people and their families in Canada. So my background is actually in research and disability support. So I learned a lot, really through my role at CASDA about accessibility and the use of social media. And so I've gathered a few tips and tricks here that I really hope will be good starting points as you develop your social media strategy and your knowledge translation plan. So I'm going to talk about inclusive design, just broadly speaking, and then I'm going to touch on social media, so accessibility considerations in social media. I do have slides on visuals and alternative text. We'll see if we get to them with time, but if anything, I'll share my slides so you'll have access to them in the future. And at the end, I've also included some resources that are quite interesting to go through if you'd like to learn more. Okay, so inclusive design, why is it important and why do we use it? So really, inclusive design, what it aims to do is to provide the best user experience for as many people as possible. So the intention is to, have content that can be accessed by a diverse range of users. And designing something with inclusion in mind, the goal is really to proactively address barriers and provide multiple ways for people to engage. So the more accessible your content, the higher your reach. So really, it's a win-win situation. So if more people can access your work, the more people you'll be able to engage with. Moving right into social media considerations. So as Pierre and Bryn mentioned earlier, it's such a useful tool for promotion, for recruitment, in so many variety of ways. But when using social media, we also have to consider that people access social media in very different ways. So the experience of using social media can really differ from person to person. So there are platforms, that were mentioned previously. So, Facebook, Twitter, YouTube, they're not fully accessible on their own, but there are some tips and methods that you can use to improve accessibility for the public or for your audience. And of course, these platforms are constantly evolving, so also important to stay up to date as they are changing. Okay, so in the next 3 slides, I've gathered a few tips that I found really useful. Again, I'm not an expert, but these are some tips that I found were really helpful, especially when, working on communications for a large audience. So I hope these will be helpful to you too. So the first thing is writing in plain language. So, keeping it simple, remembering that, people in your audience, they may not be familiar with all of the terms, especially if you're using research terminology. And, sometimes complicated language might deter people from participating or engaging. So you want to keep it simple and write in plain language. The next couple of tips are more visual. So avoiding using all caps, it's just harder to read. When you're using hashtags, try to put them at the end or mentions at the end of text-based posts, character count, but whenever possible on Facebook, Instagram, putting those at the end are super helpful. Next is capitalizing the first letter of evil. At CASDA, we often use National Autism Strategy, just like clumped in one hashtag. So we'll capitalize the N, A, and S just to make it more readable. Okay, next, limiting the use of emojis and avoiding special characters. Again, these could be hard or create breaks when people are using screen readers, for example. So unless you really want to use them, limiting the use of them is generally a better practice for accessibility. When you're using call to actions, suggestions would be to use more descriptive call to actions rather than click here, sign up to this study or register for free or subscribe to this newsletter. Those are good ways to use descriptive call to actions. Limiting line length or reducing how long your sentences are appearing online can also help with accessibility. Providing alternative text or captions whenever you use visuals or videos. So like Bryn was mentioning, using images is super important and can help with engagement. And what can help even more is, providing a caption or alternative text. I do have some slides on this, so we'll see if we can get to them. Including multiple ways for folks to contact you in your organization. So if you're comfortable and you have a phone number, you can use that in addition to your email address. So that can give someone, 2 ways to contact you. And then the last 2 are quite important. So number 1 is being mindful of, spaces that are really dedicated to, for example, persons with lived experience who are there to gather and share their thoughts with others. So for example, if you don't have a relationship in or with the community of your focus, try to build bridges with that community, but also being mindful that there are some spaces that are really meant for sharing experiences, so maybe less appropriate for recruitment, for example. And then the next is the use of inclusive language. This is super important. Using inclusive language consistently will enable you to have, better rapport with the folks that you're engaging with, being respectful of preferred language, creating a safer space, and, just being mindful of the words being used. And, when in doubt, ask for help, ask for support. And there are a ton of resources out there. I definitely refer to a lot of resources as I'm creating communication. So there are resources out there that can help you too. Okay, moving forward on visuals, I do have a couple minutes, so all good here. I've gathered a few tidbits here on like font and format. Those are pretty straightforward, and I'm sure a lot of you already use these already. So using, an adequate font size. Some fonts are more accessible than others. So Arial, Calibri, Helvetica, for example, these are fonts that people are much more used to. So those are more readable, usually preferred. Line spacing, you want to make sure you're splitting your lines with proper spacing in between, so everything's not like clumped up. And then in terms of format, being mindful of the colors you're using. If you're using background images, trying to use images that don't like overlay text. Again, it's visually more accessible. And then if you have like posters or things to download, then you can provide multiple formats that people can download. So a Word doc or PDF or JPEG or whatever that might be. Okay, moving on to alternative text. So alternative text or alt text, this really allows people to visualize images when they can't see them. So a quote I found online that I thought was really interesting was, think of writing alt text for an image as if you're describing the image to someone over the phone. So similar to earlier, keep it simple. The alt texts, they are, it's inherent that they're images, so you don't have to write, image or picture of, but you can just sort of describe what's in that image. If there's text in the image, you can transcribe what the text is saying. And then if there's decorative content, like in my slides, you see there's little colors around here. So no need to describe decorative content when they're there. So that brings me pretty much to the end of my presentation. So the bottom line really is when you're creating a social media strategy, try to create it with accessibility in mind. So by integrating inclusive design from the start, and sometimes this takes time. So building in that additional time when you're planning to ensure that your materials that you're sharing publicly are accessible and inclusive will really be helpful. I've gathered some resources here, so feel free to click on them. They're all clickable, so you can access those after this presentation. And finally, here's my contact information. If you want to get in touch or if you want me to look over something, always happy to help. So I'm going to pass it over to Amanda. And thank you so much.
Hello, everyone. My name is Amanda, and I'm a patient partner and wouldn't be one except for social media. So I was invited here for my role as an admin on Instagram, but I wanted to share my story first. I was 2 years ago, you could only find me on Facebook, other than I had a Twitter presence to follow like 2 people, my husband and one other person, and an Instagram presence to follow my 2 oldest children. But I was introduced to I was in a couple of parent support groups because I have 6 kids. They have some complex health issues. And it was a parent there that said, hey, do you know about this Parents Partnering in Research Facebook group? You're always sharing research. You're willing to share your experience. This would be a good place for you. And this Facebook group, Parents Partnering Research, was set up as an advisory group online for Can Child and has kind of morphed into a knowledge exchange group where researchers and parents and others together share insights and opportunities and such with each other. And from there, I learned about the Family Engagement and Research Certificate of Completion course, applied and got in. I was thrilled to be able to go there. And the Instagram page that I'm going to speak to you about today, more out of our group project for that particular course. And I have to thank James Reeder and Nicole Proudfoot for that. So I'm actually, as I said, I would be here except for social media, and now I'm involved in a few different projects. So there is a lot of opportunity for capacity building and sharing and stuff in social media. I'm going to speak to you today about our project for that family engagement research course. We had to think about some of the things that Bryn talked about, who is the audience. And I was super excited about this course. I love to learn, but I also had all this lived experience that I didn't know what to do with. And I have a research background. I'm in PEI now. I've been a stay-at-home mom for a long, long time and had no idea, as I said, that patient-oriented research was a thing. But when I found that group and I found the course, it felt like this is where I needed to be. So my group and I, James and Nicole, we were thinking about who would we talk to, who would we want to target. And I spoke to my oldest, who was 19 at the time, and a friend. And I said, if you wanted to share all this wonderful stuff with youth, what would you do? And they immediately said, Instagram or TikTok. I had no idea what TikTok was. They said, but you can do it on Instagram through Instagram Reels. You can do like little mini videos, just like TikTok. So perhaps Instagram. So I brought this to my group and they said, yeah, let's run with it. So 2 of us had children that used Instagram and 1 of us was a user of Instagram, basically in the target audience that we wanted. So we worked together on this. So when we were thinking about it, we were thinking about the platform, which was essentially decided for us by the youth in our lives. We have to think about whether it's private or public. The group I spoke about, the Parents Partnering in Research group, is private. I'm in parent support groups that are private, but so it's good to maybe share with each other certain things in that group. It might be you have participants in that group you want to give feedback to, or you're discussing with each other what you're doing in your research and stuff. You might want to be public, where you're sharing broadly your research, or you're trying to recruit. You name a username. So these are the details. So I have the big picture stuff like Bryn talked about, is audience message, how can this be achieved, and who is going to do the work. There's lots of details like the name or the username. Is it taken? Does it reflect what you want to say? How are you going to do graphics? Now I use Canva, and it's a pretty popular platform, has minimal cost, free opportunities. Making them and finding them, so much pre-planning. Captions, what am I going to say? What are we going to say here? Is it going to be short? I'm on Instagram. Well, everything I said short captions, but I like details, and the other people I spoke to sometimes like details. So some of our captions on our youth engagement research page, the @youth in research, if you go to Instagram, are quite long and explain things. And this is just giving an alternate way of sharing with others. You have to think about things like permissions. Do you need to support, do you need to submit recruiting through a platform for ethics review? Is it in your plan? Do you need photo releases? So if you're sharing about some of the people that are doing the research, you should probably have a photo release. You want to share your references and stuff. How are you going to reach your audience? Hashtags are what we do, that little number sign followed by words that describe your message, and will help you get your message out there. We have certain hashtags. This is a little bit of research we did beforehand, before taking our account live, was searching what hashtags would reach the audience we wanted to use. But we also searched other accounts that were targeting a similar demographic and stuff, and followed them, so that we had an idea of how to target people, but also we kind of make friends with each other, network with each other, and we can share our posts and stuff. Links, Instagram has a link problem. So if you're familiar with Facebook or Twitter, if you have a link on there, you can just click it and go to that link. But on Instagram, you don't have that. So we shorten links with bit.ly or ally, or we use a planning software. I use Later and have a link in bio. So if you're familiar with what an Instagram account looks like, if you go through the link in bio on the Youth in Research page, you will see almost a visual representation of our posts, and you can click on each of those posts to get to a link. Others use campsite.bot to go because of this link issue. I'm just sharing with you some of the posts that we have on our Make Them, tell youth all about the opportunities they could have to be a youth partner. And research share that there are opportunities to be involved, and this is why you should be involved. This is what you can do. So we share posts about informing people about what youth engagement research might be about. We want to encourage people. So the account has morphed into also targeting researchers that might be interested in youth engagement. So we do spotlights. This is Jillian Backlund. She actually is a member of the Child Bright National Youth Advisory Panel, and she graciously agreed to be one of our first spotlights, and Dr. Burney, and you'll see either blurbs describing what it's meant to be engaged, a youth or research or trainee engaged in research with youth, or some of the background, like why they became interested and such. So just to encourage others to get involved in patient-oriented research. We share opportunities. These are just a couple that we've shared. So as I said, I network a lot, but I share a lot of opportunities. We do make some original content and point people to resources, but these are this is an opportunity through the International Children's Advisory Network. And if you don't know about them, they have advisory groups of youth ages 8 to 18 that actually can advise on clinical trials and such. And they've had quite a bit of success in helping people and providing insight into things that can change devices or the way a trial is done for researchers. The Young Canadians Roundtable on Health, youth can get involved in policy making, service provision, research studies, and everything. Lots of opportunities there if you know to look for them. And as I said, the youth that I was speaking to didn't always know there were opportunities there, didn't know where to look. And we also show examples of youth engagement research or impact. So remember those YPEG, the YPEGs I spoke about. This particular study, I showed all of the interaction of the YPEG and the research team. The researchers at the beginning had the perception that they didn't expect to have so much influence from the young people on their study. And so this, I really, really want to push. We really want to push that youth can impact a study. People with lived experience can have so much impact on your study. It's really, really nice to get that interaction that and share together, co-learn together, and guide research together. This particular study was actually a capsule to look at gastrointestinal transit, and the youth basically changed the prototype and so that it was acceptable to youth. Lots of made recruiting materials accessible to youth, made KT materials accessible, and many other things. And this is a study on a mental health. It was a mental health study, a mental health services implementation randomized controlled trial that youth and family were involved in. And this is an evaluation of what the engagement meant for the research after the fact. And this comment, having the youth involved and their input into everything has been a fantastic experience for me, and their participation has made the project 10 times better. And you can continue to read. So we want to share how impactful engaging with others can be. So some of the lessons I learned, and these have been already mentioned before, planning is key. There's lots of small details. Social media strategies take time, budget for that time and for cost. There are some costs. Some of your graphics might cost a little bit. And remember that time that somebody does it, that's a cost. Think teamwork, learn from others, get input from your audience, share responsibilities. I would not recommend that you do this on your own. It really is a group thing, especially if you're doing a research project together. Networking can help you spread your message. And when you think you have it figured out, things can change. You will, if you go to our Instagram account, you will notice with time, we go from small letters in our hashtags to camel case that Rocky spoke about, capitals at the beginning of each. You'll notice things like image descriptions get included and other things. And I'm probably go and update the post going forward based on some of the things that have been said here today. So I wanted to show you another great example using a different management software, campsite.bio, so people can go to other social media. This is the Canadian Retinoblastoma Research Advisory Board. And I'm going to point out they have a nice color scheme, but they also have, they're targeting like KT strategies. They're trying to get people involved. They do spotlights similar to what we do. This is one of the only examples I found, our group found actually when we were developing our project. And I really, really encourage you to go ahead and look at it. They use Campsite Bio, so they can link to their Twitter, their Facebook, their YouTube channel, their website, and their email. And you see it's not a visual links that you can go to, but if they can prioritize the links they want to direct people to. And just before I leave, I'm going to head over to TikTok, which graciously, our next speaker, Brooke, will speak about. It's not my platform, but I appreciate anybody who can use it effectively. And while Brooke will speak about it with her project, I wanted to share with you a TikTok video from Rachel Martins to show you how it can be used for patient-oriented research.
Watch this. Now you have to imagine it with two people. It's swell with two people. First I, then she. Then we'd. But I can't do it alone.
So now I'm going to pass it on to Brooke.
Thank you so much, Amanda. This has been a really informative discussion, and thanks to all the speakers and for inviting me to share. In the last 5 minutes here, so my name is Brooke. I'm a PhD candidate in the Faculty of Social Work at the University of Calgary. And I'll just share a couple examples with you of how we've used primarily TikTok, but also Instagram in order to share findings about a particular research project titled the Ready to Exit Study, which is my thesis project. So this is a patient-oriented research project that's being conducted in partnership with 5 young adults with lived experience. And we're looking at the concept of transitions from pediatric to adult care. So that makes sense that our target audience for kind of sharing our findings is youth and young adults. And so why did we develop these 2 platforms for this research project? Well, this was suggested by my 5 fantastic young adult research partners in the early stages of our work together, because we thought it really made sense to share both the process of our partnership in research, but also the results as they were, coming about with young people on platforms that would be accessible to them. And so we thought we would develop these platforms to both share research findings, but also to demystify youth engagement processes and to raise awareness about different types of research, data, and what patient roles can look like in the research process. And so we did obtain research ethics approval to develop the @Youth Research Study Instagram and TikTok accounts. And these were co-developed with my 5 young adult research partners in December of last year. And we also held a consultation with a provincial youth advisory council about what kinds of content would be relevant and interesting to young people. And so to date, we've used these platforms primarily for recruitment purposes as we're looking for qualitative interview participants at this phase of our project, but we're also planning to use it for integrated knowledge translation around youth engagement and patient-oriented research principles, and have found it really useful to connect with other researchers, clinicians, and even youth who are interested in this topic. And because we have both TikTok and Instagram, I thought it would be interesting to just share with you what our reach and engagement has looked like across these 2 platforms. So while we primarily create our content on TikTok, we're able to share our short videos using Instagram Reels. And so far we've found that our reach is actually a bit bigger, and we're able to reach more people on Instagram. However, I think we're getting a pretty good engagement and traction across these 2 platforms. So I think just this speaks to the importance of identifying like where your target audience is and who you want to reach with your content. And so I want to leave time for questions. So I'm just going to share maybe 3 examples with you of how we've used TikTok to really share information in fun, engaging, and youth-friendly ways for this project. And you can check out more of our posts by following or checking us out on Instagram or TikTok @Youth Research Study. So here's one.
Too often, health research is done on youth as opposed to with youth. I'm passionate about partnering with youth in the research process, as this can be incredibly transformative, leading to relevant and impactful research. Youth bring their unique lived experiences into the research process, ensuring the questions we ask, the methods we use, and the outputs we design align with their needs. Have other questions about youth engagement and research? Comment below.
There's one that was more focused on sort of raising awareness. And now I'm really pleased to share a fantastic video about how one of our young adult research partners was involved in co-designing some of our interview materials.
Hi, my name is Megan. I'm one of the young adult research partners on the Ready to Exit study. Today I'm going to be talking about interview guides. An interview guide is a list of topics or questions that Brooke will cover during your interview. They'll help guide your conversation. The Ready to Exit interview guide was co-designed with us, the 5 young adults on the project. That means people close to your age with similar lived experiences helped pick out the questions you'll be asked. We used our own experiences as research participants to help restructure and reword the questions to make them more youth-friendly and easy to understand. We made sure any questions that you'll be asked we would be able to answer if we were being interviewed. If you have any questions or would like more information about getting involved with the study, please feel free to reach out to Brooke.
That was Megan. Thank you so much, Megan. And here's a final video that I'll show you. The young people I've spoken to suggested using trends and trying to have fun. So here's an example of our efforts to do that. There you go. So these are just a few examples, and I'm just going to skip over the last couple for the sake of time and wrap up with a few lessons learned, which I think everyone has covered. I would say the key lesson that I've learned is the importance of consulting and actually partnering with folks in your target audience to identify both the optimal platforms that you can use, but also the types of content that would be relevant to your key audience. So the young people I've spoken to suggest using trending sounds, particularly on TikTok, as that helps with the algorithms and visibility of your content, using humor, experimenting with different formats, and using hashtags to reach a broader audience. So I just want to end by acknowledging everyone who's part of this project and team, most notably the 5 young adult research partners I'm collaborating on this project with. And I'll turn it over to Kent for questions. Thank you so much.
Thank you, Brooke. All right, Kent.
Yes.
Yeah, so it's over to you, Kent.
Thank you so much.
In the dwindling few, sorry, Kent, in the dwindling 2 minutes we have, I figure we can open it up to some quick questions and answers from all of our audience members today. That said, however, if something tickles your fancy after the session, feel free to send the question my way, and we certainly relay it to our speakers today and get their input.
What he said. And thank you everyone for giving us this stimulating food for thought this morning. And well, I guess it's afternoon for some, depending on where you're joining us. And if you're listening to us in the future, well, hello to the listeners and viewers of the future from the presenters of the past. And I hope that once this is posted on YouTube, I know we always monitor the comments section on YouTube, but we haven't gotten a lot of traction there. But if any of the future YouTube viewers have thoughts or feedback, you can certainly reach us there as well. I invited a few minutes ago for people to post questions in the chat. I don't see any burning questions there. So as Pierre said in our last few moments together, that gives me the opportunity to indulge my own curiosities. And in this case, I'd like to just take a minute to ask the presenters to talk about any of the most surprising results or outcomes that have happened in their cases as a result of using social media platforms in these capacities. Anyone who wants to go first?
I'll go first. I do this, as I said, this started as a project, and we agreed as a group that I would take it forward because I have a passion to share with youth and provide opportunities for them, having been the youth that wasn't listened to way back when. But what has been interesting to me is that it seems to have made a difference. Some people will come back and say, well, we learned about this opportunity through this platform. We've had people reach out and say, can you share this for me? Can you share this talk? Can you share other things. And we've even had youth reach out and say, you know, I'm really interested in this. I live in, say, Toronto. Can you figure out, you know, find out where I might be able to get connected? And because of those connections I've made or the opportunities you've shared, I've been able to steer them in a direction. I think that that's probably the most meaningful to me is youth come in and say, you know, thank you for doing this. Do you know where I might get connected? This is what I'm interested in.
Excellent. I wonder if anyone else, Brooke, do you have any particular thoughts on surprising outcomes?
I don't know if this is a surprise, but I just feel so privileged to get to work with the 5 young adults that I'm partnering with on the project and really hearing about their creative ideas for how we can share information in ways that will help us to reach youth and young people and meet them where they're at. Often we see research, you know, sitting on these shelves because it's in these academic journals. And I'm just really passionate about trying to get this into the hands of people who really need the information. So although it's not a surprise, I think it's been really fun to see how our social media platforms have evolved. We have so many ideas for the future. And so I'm just excited to see where all of this will go and hope we can keep connecting with folks and reaching people.
Excellent. Sounds like maybe you were surprised by some of the capacities that your youth partners brought to the table that maybe you hadn't expected.
There you go. They're full of amazing ideas and creativity.
Super duper. And according to my clock, that brings us to just over time for today's presentation. So Pierre, I'll turn it over to you for some closing remarks.
That was wonderful. Yeah, so I just want to thank all of our presenters today. I want to thank Kent, Bryn, Ricky, Amanda, and Brooke for joining us today and sharing some of their experiences and expertise. And I hope there are some food for thought you will able to take away today and consider how some of these elements can be incorporated into your various projects and capacities in your day-to-day activities. So we'll be sure to reach out with some of the resources and references we've mentioned during the presentation today. So once this video is uploaded, I'll be sure to send out a note to all of the attendees with that information. And of course, if you have any questions, feel free to reach out. And just a last note, as was outlined in the, I guess, in your chat box, there was a link for a feedback survey, as this particular topic was crowdsourced from previous attendees. So if there's any particular issue relevant to patient-oriented research that you would want to see explored, feel free to provide that feedback, and we'll be happy to work on getting that organized. So with that all said, thank you for sticking with us to the end. I hope you all have a wonderful rest of your week.